Hertie Summit 2025. Bar Lun Leer. Risk assessments. How can we end domestic abuse sooner? Bar Lun Leer co-founded Frontline, a social startup that develops innovative approaches to combat domestic abuse. As a social data scientist, she designs data-driven strategies for social change. Forbes recognized her in the 30 Under 30 list in the social impact category. Please welcome Bar Lun.
Hi, hello everyone. My name is Ling, and for my presentation I will discuss how we can end domestic abuse specifically, but really any other public policy problem generally, earlier and more effective. First, let's consider why domestic abuse is a public policy problem to begin with. One, it is extremely common. 1 in 4 women and 1 in 5 men in Germany will experience abuse by a former or current partner at least once in their lifetime. 2, abuse is horrible, but sometimes it can be fatal. And in Germany, right now, we are at a time where every second day, a woman is killed by their partner in Germany. And 3, the costs are immense, not just to the victim or the loved ones, but to the whole society in Germany, with costs of 32 billion euros annually. And so we must ask ourselves, what are we doing to address this problem? Most countries in the European Union are following what I loosely call the British model, which consists of high level of policing, of carceral solutions for perpetrators, meaning legal penalties, prison sentences, coordinated interinstitutional conferences, meaning roundtables where the police, public prosecution, counseling services, shelters, and other specialized service come to one table to discuss how are we going to support this victim. And there's also shelters for victims. And what you might have realized, just looking at this list, is that all of these are crisis interventions. These are interventions which we take when there is no point, when we've reached a point of no return, i.e. the perpetrator has to be put into prison or the victim has to be relocated. So these interventions happen quite late, after years of abuse. They are not sustainable, they are very costly, and they're also not scalable. And what's missing entirely are interventions that reach in sooner, i.e. prevention. And so how do we end domestic abuse sooner? By focusing on interventions which are scalable, early, and effective. Scalable, as in they reach more than 20% of the target population. Early, they reach in earlier, so we reduce the overall number of instances. And they're effective. They're proven to be effective in targeting the issue at hand. And so as an example, this COVID-19, and I think vaccines and masks are no-brainer. Obviously, they happen quite early. They can be distributed to the whole population. And they're also effective. And they can, more importantly, they can help us reduce the COVID number of patients. If you're already infected, well, then there's hospitalization and then patient treatment, which is also effective, but it happens late after transmission of disease. And sometimes there's solutions which are not really solutions, like ivermectin or cow dewormer. I don't know whether you've heard of it, but in the United States, some people used it to treat COVID-19, and unfortunately, it's been proven to be an ineffective one and also highly poisonous, too. And so the things we want to focus on are things that are effective, so everything above the line, but more importantly, things that are also scalable. And these just happen to be in the top left corner. They're effective, they're early, and they're also scalable. And by focusing on things in the top left corner, we can also help lessen the burden and the costs in the top right corner, which tend to be more expensive. So going back to the British model, unfortunately, all of these interventions are in the top right corner. They happen late, they are costly. So now you might be imagining, well, what is there in the top left corner to do about domestic abuse? There's loads. There is public awareness campaigns, such as Gewalt kommt mir nicht in Tüten, which is just like published on baked good bags to show that abuse, whether it be by a stranger or a loved one, is not tolerated in the society. There's chatbots which can help us develop healthier gender beliefs and skills. And there's the international hand sign. And this is actually something I'd like to try out with you. So everyone please raise their hand, one of those, doesn't matter. Then we fold the thumb, lovely, and then we fold the fingers. Great, great execution, thank you. This is the international hand sign to show distress, to silently ask for help. If you know this, this is already great, and next time you see this, you know to help or to intervene. And so chatbots, awareness campaigns, this hand sign, these are all interventions which I can introduce to the whole population. And they're also quite effective. But what happens if abuse has already happened? Well, then there's risk assessments. Risk assessments are tools, checklists to ask what has a person experienced in terms of abuse by a partner, and what is the risk of this happening again or worsening even. And they're also tools mandated in the whole of the European Union, i.e. every authority, police, social workers which comes in contact with a victim of domestic abuse has to conduct a domestic abuse risk assessment according to Article 51 of the Istanbul Convention and Article 16 and 17 of the EU Directive on Gender-Based Violence. And these risk assessments are really important because they determine follow-up support. The lower the risk, the less support you get. The higher the risk, the more support you get. But what if you get it wrong? What if you predict someone is going to be abused, but they weren't actually? Well, that's a false positive. I mean, at the worst, this is going to waste resources, but that doesn't really harm anyone. What if you get a false negative? What if you predict someone is safe, and they weren't? Well, the consequences of that can be quite tragic, and at worst, it's a femicide. And so estimating risks reliably and accurately matters. And this is what my colleagues and me have been doing at Frontline for the past 4 years. The main takeaway of this presentation, however, is the framework: scalable, early, effective. In any public policy issue, you would want to focus on solutions in the top left corner, which helps you reduce the number of incidences in the top right corner. Instead of putting out fire, maybe let's try to prevent fires from happening in the first place. Thank you.